Today's Pharma. In this video, we will learn about the drug aspirin, which is also known as acetylsalicylic acid. The aspirin, we know it came into being in the late 1890s, where when a famous scientist, Felix Hoffmann, used this drug for the treatment of arthritis in his father. So aspirin, it has a very long history. It has been used as an analgesic and antibiotic since a very, very long time. So let's see how does it work. So we have the cell membranes, and the main constitute of these cell membranes in all of our cells are phospholipids. What actually happens is that in as a response of any stimulus, this stimulus, it could be any bacterial toxin or any viral toxin, it stimulates the phospholipids in the cell membrane. This is the cell membrane. This stimulus, it causes the phospholipids in the cell membrane to produce arachidonic acid. Arachidonic acid is basically a precursor that is involved in the formation of many inflammatory modulators or many inflammatory mediators. So this arachidonic acid, the conversion of the phospholipids into the arachidonic acid, is commenced by an enzyme which is present here. This enzyme is called as phospholipase. Now, this arachidonic acid, it is converted into inflammatory mediators by two enzymes. We have an enzyme which is known as LOX. It is also called as lipoxygenase, and we have COX, which is called as cyclooxygenase. So this enzyme, it converts the arachidonic acid into three kinds of compounds or molecules, and these molecules are responsible for producing various effects in the body. So we have prostaglandins, we have thromboxane, and we have prostacyclins. Both these compounds, they play a major role in the process of inflammation. So this is the normal physiological response of the body in response to any stimulus. So this stimulus, it could be due to any toxin. So what aspirin does, that it blocks this enzyme here. Aspirin will block the aspirin. It will block the COX enzyme, and as a result, all of this process is inhibited, and it acts as an anti-inflammatory drug by this mechanism. Aspirin has been in clinical use since a very, very long time, and it has many clinical uses. We will discuss them one by one with their doses, but let's talk about the pharmacokinetics, a little bit about the pharmacokinetics of the aspirin. Pharmacokinetics is basically the study of a drug disposition in the body. Whenever the onset of action of aspirin is very quick, it has an immediate effect if the drug is not indirect coded. And if the drug is indirect coded, then it will take about 3 to 4 hours to produce its effect in the body. So the onset is pretty quick. Duration is very important to remember because it helps us to decide the frequency of drug dosing in the day. So aspirin has a duration of action that lasts for around 4 to 6 hours. So if you give your patient aspirin, the effect of aspirin will last for about 4 to 6 hours as an analgesic and an anti-inflammatory drug. But it has its effect. It has a prolonged effect on platelets, and it's irreversibly bind with the platelets. So the effect that it has on platelets, it lasts for around 10 days, which is the life of lifespan of platelets. The metabolism, it is metabolized in the liver and in the esterases, which are present in the RBCs, in the blood, in the gut mucosa, and everywhere. And it is metabolized into salicylic acid or salicylate by the esterases that are present throughout the body. So here we have some esterases, and they convert the acetyl salicylic acid into salicylate. This salicylate is excreted in the urine,